I'm S.K. Nanda. I'm a retired IAS officer from Haryana cadre. My wife, Mrs. Umesh Nanda, is also an IAS officer from Haryana cadre. We both are from 76 and 74 batch respectively. In order to avoid the Delhi winter, we used to come to Goa every year during winter time. And this time when we came on 8th of November, we had a party in our house on 12th of November about my son's birthday. But unfortunately on 13th of November, my wife fell down in the bathroom and she had a brain stroke. She was treated for 3 months in Goa, but nothing happened and we did not get the desired result. Then we brought her to Bangalore. From 1st of March to 10th of March 2022, she was treated there and we did not also get the proper result there. My wife started having pulmonary embolism because she kept on bedridden for months together and doctors could not place it. On 10th of March 2022 at 10 o'clock in the night when we landed up in the emergency ward in Apollo, Banerghata Road, actually we met Dr. Steve Paul and he was excellent in not only in his observations and detecting what all had happened to my wife, also his treatment for 1 month and 5 days from 10th of March to 15th of April, it was fantastic. We got the desired result and my wife improved, and then all types of treatments, anything related to bedridden treatments, all neurosurgical treatments, all other whatever are required for my wife, they were all taken care of and we were totally satisfied. Then we brought her home on 16th of April. Since then she was there in she's being treated at home and with 2 nurses for 24 hours. So we are totally satisfied and we find Dr. Steve Paul a very efficient and a very, very cooperative and understanding doctor. Thank you.
Hi, I'm Dr. Steve, consultant geriatrician at Apollo Hospitals, Bangalore. I remember this patient, Mrs. Nanda, who was admitted here. She was actually transferred from another hospital due to worsening health condition. She's had a stroke a few months ago. She had been bedridden in a hospital. She developed multiple pulmonary emboli. She also had kidney disease and she's post a stroke, so she was nearly paralyzed. There was an ongoing bed sore and she was already on a feeding tube and on a catheter with severe urinary infection. So given her age and her conditions, this was quite a task for us to how to put all these pieces together and try and solve each problems. Age itself was a confounding factor. There are many other problems that requires attention and the involvement of multiple specialists. This patient required ICU stay and she's been in multiple hospitals for the past few weeks. A few days into treatment, she kind of improved. We shifted her out of the ICU, only to be shifted back into ICU in the next 48 hours. We were worried about the ways things were progressing. We got the family in. We explained to them how things are likely to be worse. She may even require dialysis. This was the state she was in, but gradually her condition improved. Our focus on physiotherapy, diet, and modifying the medicines and the focus on improving her functionality was kept and she's gradually and slowly improved. Over a span of a month, she was shifted out of the ICU. Our excellent physiotherapy team saw to it that she was mobilized and in some time she was able to be maintained and managed on a wheelchair. She started looking up, nodding to our questions and responding to our queries, and her condition gradually improved. So this is the essence of geriatric medicine. The focus is always on functionality. You may not be able to reverse strokes, you may not be able to reverse heart failures, but whatever be the underlying condition, the focus is on maintaining functionality. After a span of a month or so in hospital, She was discharged on a wheelchair in a happier state. The family was glad because they had nearly given up on their mother. And a year later, when we saw her, she was smiling, she was reading newspapers, she was responding in syllables. And this admission was for a urinary infection. We saw that her catheter was removed and all the risk factors that can worsen her state was taken care of. Multiple specialists were involved, and this connection of dots is what makes geriatric medicine so special, so time consuming, and which is why we need to be meticulously looking into every single detail so that the person maintains his or her functionality, because we believe age is just a number.